carrying out today a procedure on a COVID-19 patient. She is complaining about respiratory distress, which is a very common symptom in COVID-19 patients, as the sickness is affecting the lungs and causing pneumonia. To make her more comfortable, we want to give her different positionings to release her from this symptom and to release her from the stress the difficulty in breathing is causing. I'm carrying out the procedure with my colleague nurse because we can't do this by ourselves. I will get first the consent from the patient. Good morning, Jessica. How was your night? Yeah, I heard from the night shift that you have really difficulties with your breathing and that you're in respiratory distress. So we thought, my colleague and I, that we want to make you more comfortable with your position. And so for this we are elevating your head first to 60 degrees or even higher, up to 90, so that you can breathe easier. And then we would like to put your pillow under your legs so that you don't slide down in the bed, so that your feet are not reaching the end. And then we are making you more comfortable with your arms by putting a blanket over your belly and under your shoulders, and then you're more comfortable with the breathing, hopefully, and you will have the support by the muscles in the upper arms and in the upper back to help you to breathe fine. And are you okay with that? Okay, so I will get all the materials we need and then we will start the procedure. We leave her a pillow under her head to make her more comfortable. To prevent her from sliding down in the bed and reaching with the feet the end of the bed, we are giving her a pillow under the feet. Jessica, we remove the blanket, yeah? Okay, this will stop her from sliding down in the bed, and now we are using either two pillows or a blanket to make her more comfortable with the upper body. So for this we have to remove the blanket again from you. Good. So we are done so far. Is this position okay for you? We will come back later, yeah? After I've done my nursing procedures, even when I'm in the red zone, it is important to reduce the risk of cross-infections between my patients, because I have maybe more than one. And so I have to follow the protocols for proper hand hygiene. This tells me now, after the procedure, I have to take off my first layer of gloves. Put them from the outside and the second one from the inside. And afterwards I have to sanitize my hands and follow the steps. In our nursing care, it is important that we are writing afterwards our records about the procedures we have done. So I'm taking the patient chart after my procedure and I'm writing down the time, what I have done, and how the reaction of the patients to this intervention was. I'm taking care of a COVID-19 patient today, and the patient has difficulty in breathing, and we want to improve her gas exchange in the lungs and the lung ventilation. So for this nursing procedure we need 2 pillows, and we do different positioning to increase the gas exchange in the lung. During this procedure we are positioning, we have 4 opportunities to position the pillows for the patient. The first one is the V. So this means the pillows are laying under the patient. The patient is in this direction and they are showing a V. In the other option it is a. So we put here's the head of the patient and here's the body. So the A. Then we have the opportunity to put the pillows as a T. Here to me is the head and here is the body of the patient. And then we have the I. Then the patient's head is here and the patient is laying on the pillow in the middle. Jessica, we would like to show you some positionings and offer you some positions which are improving your gas exchange in the lungs so that the air can go better in and out from your lung. The first one is the V we would like to show you, and this will help especially the middle of the lungs and the back to exchange more gas, because the pillows will be more to the side. Yeah, and your arms will rest as well, and we can activate again the muscles of the upper arms and the upper back to help you with the breathing. And the A is the opposite to the V, obviously, and it will help as well here, this middle of the chest, to exchange the gas better and will give you more capacity in that area to breathe. The T will help you on the sides, because you're laying in the middle with your torso on the pillows. So the sides will have here the capacity to exchange more gas, and your head will lay down on the second pillow. The fourth one is the I, so we are taking the one out which is under your head, and we will just have here in the middle on the sides the gas exchange area free to support you with your breathing. After I've done my nursing procedures, even when I'm in the red zone, it is important to reduce the risk of cross-infections between my patients, because I have maybe more than one, and so I have to follow the protocols for proper hand hygiene. This tells me now, after the procedure, I have to take off my first layer of gloves. Put them from the outside and the second one from the inside. And afterwards I have to sanitize my hands and follow the steps. The demonstrations we have just done on Jessica with the V, A, T and I positioning and the pillows are also applicable for children, but then we can't use the big pillows, especially for the under 5s, but we can still use lapas, so we can still position them in the V, the A, the T and the I, and the child will lay on it. So it is the same procedure, but just with smaller pillows according to the size of the child. And also for this procedure, when we are doing this kind of positioning, we are writing down in our patient charts what we have done, when was this, and also the effect on the patient, and if we could reduce the symptoms of the patient with our positioning and make the patient more comfortable.
Managing patients with COVID-19. As one of the symptoms of COVID is difficult breathing, we want to do a symptomatic management of the difficult breathing. How do we do that as nurses? We go to our patients. In the lying position, if they cannot help it, we want to teach them some breathing exercise that will promote ventilation or lung exercise. So you see me put on my neck gloves whilst I go and talk to my patient regarding the breathing exercise and how I teach my patients how to be practicing breathing exercise. Now I put on the second layer of gloves my patient. Madam Jessica, good afternoon.
Good afternoon, sister.
We know you are having this problem of difficult breathing.
Yeah.
I'm here to help you out. Yeah? We want to do some exercise that will help promote your lung ventilation. As I practice with you now, when I'm out of your room, you can continue to do that as we promote the lungs and air ventilation. Yeah? So, Madam Jessica, in this position, like, please excuse me as I touch. Yeah? I will hold below your breast like this, and you take in deep breath. You are going to take in deep breath, like you are moving my hands away from your chest. Yeah? So then you take a deep breath. Down. Good. Again. Slowly down. One more time, please. In. Down. We are repeating this for like 5 times and then we move up. Please excuse me as I want to lay my hands on top of your breast. You are doing the same, yeah? Like you did before. Take a deep breath in. Good. Down. Slowly down. Again, deep breath in. Down. One more time for this. Then down. I can also ask my patient to turn towards the left or any of the side. She can turn to the left whilst I do the same for her on the other side. Thank you, Madam Jessica. If your patient cannot turn for herself, then you need to support your patient to turn towards the left. And then you're still going to hold. Tell your patient to take a deep breath. Hold the side. Madam. Down. Again. Down. This actually promotes ventilation, and we know this is a problem for COVID-19 patients. So telling the patient to be taking in deep breath, then you are allowing the lung to be ventilated and relieve the patient from difficult breathing. One more time, please. In and down. You can do this for like 5 times with the patient and encourage the patient to be taking in deep breath to promote ventilation. Thank you very much. Madam Jessica, please just turn. You can. To help you out again, if this one is sometimes difficult, I want you to sit up, please, so we can teach you the other way that you can be doing your exercise. Okay. So just take off your mask gently. Thank you. So for this one, you are going to close your lips, take in deep breath with your nostrils, and then when you want to breathe out, you are using like a whistle out. So let's see how you go about that. Take a deep breath with lips closed. Then breathe out like a whistle. Wow. Down slowly for like 5 to 2. Again. Deep breath in, whistle out. Thank you. So you are going to do this with lips closed. You take in deep breath with the nostrils, and then you now breathe out with the lips. Thank you. The patient can do this for several times to promote ventilation and then relieve the difficult breathing. Thank you, Madam Jessica. So after this, how are you feeling now?
A bit better.
Better. So in your quiet moments alone, when you think you are having problem with your breathing, you can be breathing in and out, taking deep breath. Yeah? Put on your mask again. Thank you. Like that if you think so. Leaving your patient comfortable after each of your procedure. And then, thank you very much, Madam Jessica. I might come back after 2 hours to see how we can do the exercise, okay?
Okay.
Just rest.
Okay.
Thank you. Now, into my room, try to remove my first layer of gloves. Dispose of. Wash the second layer or sanitize it, and then record very critical for us to keep record of all interventions or nursing care we do for our patients for continuity of care. So I now record the exercises I did for Madam Jessica in our chat, and then I sign against it.
Today, I'll be performing nose and mouth care on a patient who is critically ill. Because a patient who is ill has NG tube inserted, and therefore the nose has to be cared for to prevent dryness. Also, a patient who is on oxygen therapy needs care of the mouth, because most times this patient will be breathing through the mouth and the mouth dries up and there is tendency for the skin to break, the mucosa to break. And this causes sores in the patient's mouth, and the aim is to prevent these sores. Also, cleaning of the mouth will prevent odors, will prevent inflammation of the gum and bleeding. So it is very, very important that critically ill patients be cared for to prevent such sores. So the requirement that I have here includes a towel to protect the patient's skin from soiling during the procedure. So I have here with me water, because I'll be soaking the brush a little bit to clean the mouth. I have here brush and toothpaste to brush the teeth. I have here a restrictions to spit, gauze for inspection, and for care of the nose, I have Q-tips that I'll be using to clean the nose and at the same time lubricate the nose strips. And this is the lubricant, petroleum jelly, that I'll be using to lubricate the nose. Of course, I have my sanitizer for hand hygiene. And finally, I have the gloves for infection prevention. But first, I am going to my patient to explain the procedure. Hello, Jessica. How are you today? So my name is Frances. I'll be caring for your mouth and nose. Today, this is very, very important. You know, when you're on oxygen therapy and, of course, NG tube, first, your mouth gets dry simply because you are breathing through your mouth. And to help you care for the mouth means we will be preventing dryness and sores. And also, I will have to help you with your nose, clean your nose, lubricate your nose to also prevent dryness and sores. Is that okay with you? Okay? It's okay, right? Oh, thank you, Jessica. Give me a few seconds, I'll be here, okay? Do you have any question? No? Okay, thank you. Okay, now I am going to my patient Jessica to perform the procedure. Hello, Jessica. Now I am here to help you care for the mouth and the nose. Is that still okay with you? Okay, thank you. The aim here is to prevent sores, bad odor, inflammation of the tongue, the gum, and much more other complications. Is this okay? Still okay with you? Okay. So I am going to first of all remove your oxygen mask. If during the procedure or at any time you feel you are distressed and you need your oxygen mask, can you please tell me? And I'll be most willing to fix your mask again, okay? Okay. So I'm going to take your mask out. And I'm going to put it right here closer by you, just in case you need help. So I am going to apply the towel to prevent your clothing and your chest wall from soiling. Is that okay? Jessica, do you have any question to ask before I continue with this procedure? You're fine. Okay, thank you. So Jessica, let me just check your mouth first and see whether there is any swelling. Okay. Good. That's good. Are you having any pain in your mouth? No. No. Okay. Good. That's good. I want to brush Jessica's teeth, clean the mouth, and then I will clean the tongue. And I'm going to dip the toothbrush in water and then apply the paste just a little bit. And I'm going to help Jessica to brush her teeth. So, Jessica. So I'm going to use backward and forward to clean the teeth down, the outside of the teeth, the outside up, and going back the other way, down, outside, and then up, back and forth. I'll do the same for the inside. Again, up and down, and then I'll clean the teeth upwards and down. Jessica, can you just help me with your tongue out a little bit? And then I'll clean the tongue. Can you please spit a little bit? Okay. Can you please take some water to gargle? Can you spit for me, Jessica? Yes, again. Is that okay? Are you now fine? Do you feel freshen up? Okay. Thank you. Yeah. Okay. Just in case you have further questions or you need further help, call on me, okay? I'll be very much happy to help. Thank you. So, I am done with the procedure. Now, I want to document whatever I have done. But before that, I want to ensure I remove my apron and the top gloves before getting onto the table. done. Care of the mouth and nose. Time done. Now it's 12:21. So let's say 12:15 because I took some time to remove my apron and my gloves. Patients on NG tube and oxygen therapy. Patient remains stable. No other complaint from patients. Sorry. So this brings me to the end of my procedure. Documentation is key for continuity of care. Thank you.
I'm Nurse Martha. This morning I have a nursing procedure to carry to my patient. I'm going to give my patient injection morphine. For me to do that, I have to assemble my equipment. This is a trolley, a medicine trolley. On top of the medicine trolley, I have my kidney dish. I have the injection morphine. This one is 10 milligram. I have my syringe. I also have my needle. Then I have the subcutaneous cannula. I have an alcohol swab. Underneath the trolley, you'll see the sharp box. Subcutaneous route allows medication to absorb slowly. Before I start this procedure, I'll move first to my patient. I need to inform my patient about the procedure, then I gain the patient's consent. Good morning, Miss Jessica. How was your night? Oh, I know, because I know you have a lot of pain. Then I can see the respiratory distress. This morning, I'm going to give you injection morphine for it to relieve the respiratory distress and also to reduce the pain. Are you okay with that? Okay, that's good. Just give me some time so that I will prepare the injection. I'm coming. Then I'll move to my injection room. So this is the injection, the ampoule. I need 5 milligram of this injection. That's 0.5 mils. Okay. Need to dispense of the ear. The other way. Then I'm going to change the needle. Then I insert the subcutaneous needle. This is the patient chart. I need to confirm that this is the right patient, the right medication, the right dose, the right route, and the right time. So it's okay for me. Then I'll move my trolley to the bedside of the patient. Jessica. I'm here for the procedure which I informed you before. I'm going to give you injection morphine, but I have various sites to give. I want you to choose the one you prefer. I can either use the lateral aspect of the upper arm, or I can use the umbilical region, or I will use the thigh. So which one do you choose? Okay, since you choose the thigh, now I'm going to expose the thigh so that I can give you the injection. Excuse me. So this is the thigh, and this is the side, the lateral aspect of the thigh. I want to administer the injection. So it will be a little bit painful, but you have to bear it up for you to relieve of this pain and also the respiratory distress. So this is my cold swab. I need to clean the area first. Okay, really good. Okay, Jessica, thank you. This is my dominant arm. I have the injection morphine to administer. Then the non-dominant arm is for me to lift the skin. I'm going to use the 90 degrees to inject this injection. I'll give slowly for 10 seconds. Please, we don't need to massage. Jessica, don't massage. I'm not going to massage because it will absorb for itself. Okay, so just stay calm. Now I'll make her comfortable. So how are you feeling? Are you fine? Okay, so I'm coming. Let me document my injection. So now I'm going back to the table to ensure that I record what I've done. Now I'll remove the first pair of gloves which I used to administer. Then this guy. Then I'm going to use my hand sanitizer to sanitize the second pair of gloves if I touch my pen. I've done my procedure successfully. Now I'm going to record the injection which I have given to my patients and also the time. Then I'll sign.